Welcome to the overview of social welfare policy as we look at social policy making in Chapter 17, if you're following along in the online PDF, Chapter 19 in the book. And we're going to look at the social policy challenges that we face in America today and how government can be a part of the problem or possibly the challenge in some cases. This is a major aspect of politics and the policy agenda that we see today. We see this across schools, in education. We see this across hospitals and in doctors' offices in terms of healthcare. We also see this in police stations and in jails and in prisons and in fire departments and the aspects of community policing and crime. So all of these really take such a front seat of what's going on domestically in terms of the challenges that government is facing in terms of trying to address these. And citizens are very involved in how they feel on these particular issues. So before we go any further, let's talk about the social ideology of liberals, conservatives, and libertarians in this capacity. Now, we know that liberals favor less defense spending. They think more money should be spent domestically than getting involved in other things outside of our country. They focus on the rights of the accused, protecting the individual rights of citizens that are in this country and people that are in this country, not just worried about other problems going on elsewhere. They don't believe government should be involved in those private matters. So think right to choose, think same-sex marriage, think what happens in your own home is in your own home, and then being very supportive of public schools and public school teachers and the separation, a wall of separation, if you will, according to the liberal ideology, a wall of separation between church and state when it comes to those schools. So they oppose vouchers, oppose public funding of private institutions in terms of their schooling, and they're really focused on social liberty and really the aspects of really enshrining the individual liberties that are at work among government today. Now, conservatives, pretty much the opposite of all of those things. They favor more defense spending, more focus on policing and police presence, punishing crime, and really focusing on a law and order type of atmosphere. Less focused on the rights of the accused, more focused on bringing down crime at any in any aspect or capacity. Government is protecting traditional values. This includes religious values, even if it means intruding onto some of the freedoms that are out there. They favor a role in education, especially when it comes to funding private institutions with public dollars. That includes vouchers for religious schools, private schools, that sort of thing, and less concerned about this wall of separation between church and state. Remember, in the conservative ideology, the establishment clause is the government establishing a religion. As long as it isn't establishing a religion, then it really isn't violating the establishment clause, and that kind of is the focus. And where liberals were focused on social liberty, conservatives are more focused on social order, maintaining order in those societies. Now, like I said, very different than the liberal ideology. And then in libertarian social ideology, we see kind of a back and forth. We see them agreeing with liberals on cutting defense spending, but they and focusing on the rights of the accused, the individuals per se. That's very liberal in that ideology, again, because they want government to take a back seat to those types of roles. But then they also agree in the privatization of education, in getting government out of the way. Now, they would probably prefer no funding or little to no funding of education because government is too involved in education. So they like privatization. They like getting government out of the way when it comes to those types of issues. They are more in favor of social liberty than social order because, again, they're more focused on getting government out of the picture and reducing the size of government in all capacities in that regard. So they do favor liberals in the aspects of personal matters, in favoring a right to choose versus regulating or governing that type of decision making that's going on. So that's kind of where we see the ideology ideological breakdowns. How does that transfer to society then? Well, obviously very different from a liberal to a conservative point of view, and you have to understand this by looking at the social safety net, this idea of why do we have social policy at all? Well, it's to protect citizens. It's to protect them socially and economically. And in this respect, it's to protect them socially, again, either protecting their social liberty rights or their maintaining social order. But it's some type of social policy involved there. And then economically, in terms of trying to level the playing field, in trying to free business from regulation and over strangling of that regulation so that they can be free to do what they wish in that regard. And again, providing society with more jobs as a result of that is the mentality that's going on there. So this social safety net is really trying to address individuals from an economic and a social challenge point of view. Unemployment benefits is a great example of this, trying to solve the economic problems of people not having work, but also trying to address the leveling of the playing field that we see socially in terms of providing individuals with enough social liberty to be able to go out and find jobs that interest them, that they want to have, as opposed to being locked in to a job. And all of this is with the mindset of raising the quality of life in terms of trying to improve society and society's actions and the societal environment as a whole, whether that's improving the air quality or providing a level playing field or enhancing infrastructure such as roads or schools or hospitals or whatever the case may be. The idea is to make the world a better place, make America a better place in terms of what's going on there. And that really is the goal, socially and economically, in terms of addressing this. Now, I will say, being an economics teacher as well as a government teacher, you can't really talk about the social safety net and social policy without addressing the issues of unemployment. The idea is, why do we, in a lot of cases, why do we need these programs? Because sometimes people find themselves without a job. Sometimes businesses close and there's nothing you can do about it. Sometimes people are in between jobs or they get laid off or a business closes or they downsize and people lose their jobs. And that is a normal fact of life and from the economic cycle that we see from country to country, is that ultimately people are going to lose their jobs somewhere along the line. And that's not a reflection on them or their performance or their work product, but really a reflection of society and the cyclical nature of a lot of the businesses that we have today. So it's important to look at the unemployment rate, because the more people you have unemployed, the more you're going to need social safety net programs in order to try and help them get back on their feet. How do we level the playing field when we have 10 million people unemployed versus how do we level the playing field when we have 4 million people unemployed? Big difference in terms of those aspects. So right now with the pandemic, with COVID and the coronavirus, we have almost 10 million people that are out of work. That's significantly higher than where we have been the last 11 years since the Great Recession with the financial crisis and the mortgage meltdown that we saw in 2008 and 2009. That was significant because, again, we saw changes here in unemployment, and that impacted how much government needed to be involved in order to help people get back on their feet. So the more unemployment you have, the more government's going to need to be involved to help people get their fresh start. The less unemployment you have, the less you're going to be reliant on those programs. And so that's what makes this aspect of unemployment so important to social welfare policy, because the more you think about how linked they are in terms of the unemployment, if the unemployment rate goes up, you're going to need more social welfare programs and thus more money in this space in order to provide for the citizens that are out there, in order to provide for the people that are down on their luck and need help and need to get back on their feet. And that's what these programs are designed to do. Now, we have what's called entitlements, and this basically means that people are entitled to certain benefits that are out there. For example, people pay into different programs like Social Security and Medicare, and when they reach a certain age, they get those entitlements because they've paid into those programs. But also through paying taxes, we're entitled to other entitlements, such as unemployment insurance and disaster relief, disability payments, and the VA for the for the veterans that are out there. They have given the ultimate sacrifice, and many of them paid the ultimate sacrifice with their lives. And so it's only right that we respect them and their families by trying to address those entitlements and helping them with certain benefits that help them along the way to get back on their feet and get moving again after the challenges and the obstacles that they've experienced. So that's the importance of entitlements here, and these are across the board. These include means tested and non-means tested, which we'll talk about in a second, but they include all of the different entitlements that people are entitled to, if you will. We see this with different programs here, such as Medicaid and food stamps, the supplemental security income that we'll talk about in a minute, and the CHIP, which is the state children's health insurance program, as well as social insurance programs like Social Security and Medicare, the ones we've heard about the most. We also have disability insurance and unemployment insurance. All of these are part of these entitlements in terms of some of them you have to qualify for, some of them you don't, but the idea is that people are entitled to them as part of government programs that are trying to level the playing field in terms of the social welfare policy that is out there. Now we have means-tested entitlements, and this means that it is a need-based entitlement. You're only going to get this if you qualify. So you have to be poor enough, you have to be below the poverty line or near it in order to meet some of the programs that you see here. Also, we have programs for the elderly, for the blind, for the disabled, for those in poverty. And all of these are means tested. Depending on whether you qualify, you can get the benefits from those types of programs. That's what we mean by means tested. Think of it as need-based. Means tested is needs tested. And we see that you need it, so there we go. You get the means tested entitlement. Those that wouldn't qualify would not get the benefit. They would not get the benefit here. Now, non-means tested entitlements are things that everyone's entitled to in some way, shape, or form. It's just the benefit that you derive from it will depend on how much you've paid into the program. Now, Social Security and Medicare are two good examples of non-means tested entitlements because they're programs that we pay into. Our payroll taxes that are taken out of our check every time we get paid from the time we start a job until we retire, all of those paychecks take something out for Social Security and Medicare. And the idea is that if you've paid into those systems, using a formula, they'll plug in those numbers over the years of what you've paid, and they'll spit out a number based on how many years you paid and how long you've worked and what you've put into the system. Will spit out a monthly check, if you will, that they will basically put into your account over the life of your retirement. So once you retire, every month you'll get that check from the government for that amount, and you'll get that as long as you're alive. And the idea of that program is to help the elderly so that they don't have to work in construction jobs when they're 80. They don't have to be washing dishes in a kitchen somewhere when they're 77. The idea is that they can be on these programs and enjoy and live out their days. And we'll talk about the history of this in just a moment. But the idea here is it is non-means tested. Everybody gets something. Now, what coverage looks like in Social Security is going to be different if you've paid the minimum along the way versus if you've maxed out. Those are going to be two very different sizes of checks based on what's paid in, but everybody gets some type of benefit if you've paid into the system for that. Okay. Now, notice with the chart that we see here that it is also eating up a significantly larger and larger part of our budget. So tax revenues by 2052 are going to encompass about 24% of them being just from 24, almost a quarter of our GDP is basically the amount of product that we're actually producing each year as a country. All of the goods and services that we produce in a country within a year are basically going to be going to Social Security, Medicare, and Medicaid, which is huge. It's significant. $1 in every $4 that we make is actually going to go to pay for healthcare costs and Social Security benefits, and that is enormous. That is a huge increase in terms of where we are now and where we've been. And so this is what always leads people to talk about reforming the system and trying to change it, either to raise taxes on the benefits for those that are paying into it now, reduce the benefits that are actually being paid out, raise the retirement age, or some combination of those three. And none of those are popular, as you can imagine. But that is one of the things in order to bring down these costs that's going to have to happen sooner or later if you're going to if you're going to be successful in bringing down the ultimate costs of what we see here. So that is a challenge that elected officials are dealing with even right now as we speak in trying to address that. We can see the multiples over time. Another statistic, this from the CBO, looking at how those are increasing over time. And this projection actually showed by 2050 about 18% of the GDP is actually going towards this. Here we saw it was 24%. So again, depends on when the study was done. I think this one was more recent. But the idea is the same. Costs are increasing, and elected officials are going to have to worry about it. They're going to have to be concerned with what's happening here because it is eating more and more of the overall budget when it comes to entitlements. Now, there's some other programs to talk about here. We mentioned Social Security and Medicare being two that are very non-means tested. TANF and Medicaid and SNAP are all means tested programs. TANF is basically temporary assistance for needy families. We'll talk about it in more detail in a little bit, but it is basically replacing a program that had too much corruption, waste, fraud, and abuse. And so TANF was the new model adopted back in the 1990s that did away with the old model where the concern was people were abusing it and it was becoming very expensive and very costly and very wasteful. And so the concern again that was in terms of what critics were saying. It wasn't always not everybody agreed with that particular standpoint, but it did get bipartisan support in Congress in terms of reforming welfare and bringing on this new TANF program. So we saw a Republican Congress and a Democratic president sign on to approve this changing welfare as we know it. And we'll talk more about that with the Clinton administration when we coming up here on TANF. The other two to mention are Medicaid. Medicaid is like Medicare, but it's for people in poverty. So if you can't afford medical care because you don't make enough money, you and your family could apply for Medicaid. That's run through state programs, but a lot of the money for Medicaid is actually nationally funded. So it's a combination of usually funding from the state and then grants and other types of programs from the national government help to pay or supplement or reimburse states for the costs of those Medicaid programs. And we're seeing those continue to rise as more and more people are out of work, as you can imagine. They lose their job, they lose their benefits. One of those benefits is medical care, their health insurance. So where do they go? They're going to Medicaid. It's the only other thing that really is available. And up to this point, before Obamacare, that was basically all they had. Now, Obamacare has expanded that program, and so there's more people covered under it. And again, we'll talk about that a little later. But the idea here is that it is for people in poverty, families that are in poverty and can't afford health insurance. Medicaid is basically bridging that gap. SNAP is the other program. Again, it is means tested, and this includes things like farms, the free and reduced meals that we have in schools that are provided for. These are additional assistance programs supporting food banks and soup kitchens in order to help the elderly and those in poverty. This is a great example of a program that is kind of using national dollars to fund third-order devolution or second-order devolution in terms of passing it down to state and local governments and charitable organizations to kind of carry it out and carry it through. SNAP, we have seen increased numbers of, just in Montgomery County, you've seen how the food distribution has been going throughout the course of the pandemic. With COVID, they've been giving out lunch meals as well as additional meals over the weekends to make sure people have have food and are able to make ends meet. But SNAP has significantly been enhanced and broadened to include more people so that everybody can eat. Everybody has access to food, even though that we're in remote learning models or hybrid learning models. People, particularly children, still have access to food, and nobody's turned away in that regard. So that is the SNAP program that we see there. Again, means tested in that regard. Means tested for TANF, for Medicaid, and for SNAP. Non-means tested when it comes to Social Security and Medicare. Okay, so let's go back for a second and talk about social policy and how did we get here? How did we actually get to 2021 in terms of what we're dealing with? We talked about SNAP in light of COVID and the coronavirus, but how did we get to this social policy in terms of what we're taking care of and dealing with today with all these programs? Where did they come about? Well, we start by going back to the New Deal, which is really where all of this began. In trying to care for older citizens that were either poor or had to work through their old age, in terms of trying to address making their ends meet. And by that we mean trying to pay their bills and put food on their table and eat and not go hungry and not be forever poor until they died. So programs to help the poor, and particularly the elderly, were focused here. And so Social Security was enacted in 1935 through the FICA program. And if you ever see this on a paycheck, FICA is the program that you're paying. They're taking out payroll taxes in order to pay for Social Security for you down the road. It may not be something you need right now, and obviously you don't have access to it anyway till you're 62 and a half, 65, or 67. But the idea is that you're paying into the system once you start getting checks, and that is going to follow you wherever you go in terms of what you've paid into the system and the formula that ultimately will be paid out when you retire. So that started here in the New Deal, in those ABC soup of government programs. Social Security was one of those. The school lunch program was also a program of the New Deal, as well as disability insurance and unemployment insurance. All of this was designed to help level the playing field, trying to give everyone an equal start in terms of trying to make a new life after the war, particularly after the Depression. Then the war would hit. That would kind of change everything, and then we were trying to pick up the pieces and get back to some sense of normalcy, and that is where a lot of these programs really helped, especially during the war, to help bridge that gap. So school lunches to help provide for children who didn't have a meal, a hot meal, and disability and unemployment insurance to help with that. So all of these coming from the New Deal programs. Now, fast forward 30 years, and then we've got the Great Society. Lyndon Johnson, who takes over as president when John F. Kennedy, JFK, is assassinated, and he comes up with this Great Society, the War on Poverty. And he sits down with civil rights leaders like Dr. King and tries to figure out how can we bridge this gap. And he says, okay, we're trying to provide a level playing field, but we know that not everybody's starting from the same place. How do we try and create programs that are really going to help people, really bridge the gaps, the gaping holes, the chasm, if you will, or the canyons of gaps that we have in our country? And this is where food stamps is born. The idea of providing food stamps. We know it as WIC today, I think, is one of the programs involved in this. Women, infant, and children food programs, the cards you see in the grocery store and whatnot, are there to help level that playing field and bridge that gap. Head Start, another program to start kids earlier. And again, this is means tested in terms of what we see here with food stamps and Head Start, Medicaid, and SSI. But the idea here is Head Start is designed to start kids earlier in their early educational development so that they can get a fresh start and have that level playing field to start from. Pre-K and kindergarten programs that help kids learn how to socialize, how to learn their numbers and their letters, and really those kids that may not have had a chance because they didn't have the same type of schooling that other kids have in wealthier communities. And this really helps to bridge that gap in terms of the poverty gap of people that are out there. Medicare is a result of the Great Society. Medicare was a dream that Harry Truman had after FDR, but he was never able to get Congress to sign on to it. Truman was there when Lyndon Johnson signed the bill. He actually gave him the pen for the bill that was signed. I'm sure if you go to the Truman Presidential Library, you can probably see the pen that LBJ used when he signed the Medicare bill and gave it to former President Truman. But that was a signature program that he really fought hard for, was we have Social Security. How about making sure that they have medical benefits so they don't end up using all their Social Security money to pay for medical care? And that's where Medicare was born. It is, again, non-means tested. Everybody paying into it gets something in terms of a benefit there. And it is for people that are elderly, people that are retired. So if you're 62 and a half, 65, or 67, when you retire, you would get that benefit. And these are all coming out of the Great Society programs. We see, fast forward another 30 years, and we see that in the 1990s, we start to take a look at welfare in terms of we're in the middle of a tech boom, and maybe there's something we can do about reforming welfare, about making it work better. And I mentioned the AFDC was the Aid to Families with Dependent Children. Seemed very bloated, seemed very wasteful, and there was some level of waste, fraud, and abuse going on. People were concerned the money wasn't going to the right people. It wasn't being spent properly, and it wasn't helping people get out of poverty. It was kind of keeping them there, was kind of the argument being made. So President Clinton, a Democrat with members of Congress, a Republican Congress, signed the bill into law and ended welfare as we knew it. It was the Personal Responsibility and Work Opportunity Reconciliation Act, and it basically created this the idea of this aid to needy families program that basically changed how welfare worked, and the idea there of replacing it with a program that was going to be very different in nature, because the idea was it was going to lock people in terms of, hey, we had to at least try and work to find a job if you were going to be on the program. AFDC did not have that kind of a model. If you had additional children, that didn't keep you on the program just because you had additional kids. And so there were a lot of problems with AFDC because the concerns were that people in government weren't following up to see that people were actually using the money for which it was intended. There was a lot of problems there. And we were also in better economic times. Unemployment was really low. Almost everybody had a job that wanted one. And so it's really hard to justify paying, welfare benefits when your unemployment is like 3%, meaning we literally had to bring people in from other countries in order to fill the gaping hole of job-seeking businesses, because there were so few people that were actually even willing to be trained in these roles. So at that point, Congress said, and the president did too, let's change this program and make it so that people have to at least try and find a job, have to be looking to make a difference here in terms of what's happening. And so the legitimacy of AFDC was essentially, it was the death knell of AFDC. The good economy just put the nail in the coffin for AFDC. And the idea was really to cut back on benefits. A very Keynesian approach. When we talk about this in economics, John Maynard Keynes said, well, in bad times, you want to increase spending and cut taxes so that you can help help people get back on their feet. But in good times, you want to cut back on those things. You want to raise taxes and cut spending in order to be able to save for a rainy day. That really was kind of the mindset. And when unemployment is so low and people are doing well, why do you need social welfare programs? You should be cutting back on those types of things. So that really was the argument being made here in terms of why AFDC was on its way out the door. Now, the TANF that we see today, the idea is it is temporary. The T in TANF is temporary assistance to these needy families. So you have to, it is very needs-based, more so than ever. You have to show that you're attempting to find work. If you're unmarried and you're a minor, you have to be living with an adult or a guardian or some type of responsible adult who's vouching for you in terms of helping with childcare and whatnot. There is a maximum limit and a lifetime maximum, so you can only be on it for 2 years at a time. Now this has been suspended from recession to recession. So usually in recessionary periods, we've seen this rescinded or at least frozen in saying, okay, we're going to freeze the maximum limit, this 2-year thing, and this 5-year lifetime max, because the lifetime maxim is you can only be on TANF for a total of 5 years over your lifetime, which is totally new. AFDC did not have a lifetime max, and it didn't have a maximum limit in general. So with TANF coming in, it put these lifetime or these maximum limits on it, and that was a significant change, as well as AFDC was kind of based on how many kids you had. And so if you had an additional child, you got additional benefits. TANF basically cut that out and said, even if you have an additional child, it isn't going to increase your benefits. You're going to get the same benefits regardless of how many kids you have. So the idea was it's quote unquote discouraging you from having more children. Not sure if that really borne out in terms of the data, but that was the idea behind it. So it really was a social welfare program that was designed in a very good economy in order to really cut back on programs, and cut back it did. As you look at the data here, you can see the reach declined dramatically in terms of what we saw here. In terms of the number of children living in poverty, it actually grew after TANF was enacted, and those that were receiving the benefits actually fell off. Not sure it had its intended, well, I guess it depends on the intention, I guess, but not sure if it really met its goals or is meeting its goals, but TANF is still around, and it's still, like I said, in this recession, the lifetime and maximum time limit on there has kind of been frozen so people can be on there longer, but the intent is the same. Where do we find that balance between trying to provide a social safety net and providing too much of a social safety net? And that really is the back and forth that we see here going on. Now let's go to non-means tested entitlements for a moment, looking at Social Security. What's the issue with Social Security? Well, remember, Social Security is providing for people that are elderly, that have retired. They're getting a check from the government in order to pay for their expenses so that they don't have to go out and work in jobs in order to pay their bills and make their ends meet. So some of the problems that we see in Social Security today, though, are we're seeing a ratio that is shrinking. Now, by ratio, I mean back in 1950, it took about 16 workers, essentially, to pay for one individual that was out there. So we had a pretty healthy ratio in terms of 16 people were paying into a system that they weren't going to benefit from for years, and you're helping to pay for the one person that is retired. That's a great mix. But the problem is that number is shrinking. And in 1960, we saw it shrunk to 5-to-1 in terms of how much money is being paid into the system by people who are working, FICA taxes, and going to pay for that one person that's elderly. Now, fast forward to 2015, it's 3 workers that are paying for the one worker. And by 2035, that number is going to be 2-to-1. So as that number shrinks, again, you've got increasing healthcare costs, increasing cost of living, and other types of things that are really breaking the bank in terms of Social Security. So again, what options do you have? Remember, people are living longer too. And it's not just costs that are rising that are impacting this. It's also the fact that, this system wasn't designed for people to live for 40 years. It wasn't designed for somebody who's 65 to live to 95 or 100. It was designed for people to live about 15, 20 years, and then they would pass away, and the Social Security would recycle to the next individual, and the process would start all over. Well, as people are living longer, this is a great problem to have for Social Security. I mean, great problem for society, bad problem for Social Security, because they're living longer and they're taking better care of their health, and as a result, they're living longer. That means more people are on the system, and with fewer people paying into the system and more people on the system, obviously the ratio is shrinking. So, some solutions. None of them are good ones. We've got no, I'm kidding, but some solutions that have been proffered are things like raising the retirement age, increasing the cost of Social Security taxes in terms of those payroll taxes we're talking about. You can freeze benefits or shrink those benefits, or put a freeze on future benefits for people that are down, not yet retired, but are still paying into the system and maybe 10 years away or something. And then the other option that was offered by President George W. Bush was to privatize Social Security. I think that that one with the recession of 2001 scared a lot of people because of the concerns around privatizing Social Security and the problem that people were going to have in terms of, well, what happens when the market tanks and we've lost all our money? Well, then there's no Social Security to back you up. You've essentially privatized your Social Security, and now you have nothing left. So now we're back in the same boat as the Great Depression all over again. So you can see there are definitely challenges to these solutions. Nothing is without some costs involved in terms of what we see there. But we can't look away from the fact that we are going to have issues in terms of the program costs are increasing while the benefits and the income coming in is actually getting smaller and smaller, to the point that in this map, the projection is by 2035, looking at this data, we would have depleted all of our Social Security trust fund, and at that point, the costs would exceed the revenues that are the income that's coming in for this program from all of those people that are paying FICA taxes. Looked at a different way, if you looked at it this way, in terms of payable benefits and the revenue that's coming in. You can see here in 2020 that it again is about 2035 when we will have depleted all of the reserves that are available. About 79% of the scheduled benefits will be paid for, but that is leaving a very sizable gap that is of concern down the road, and that is not good. That is not good, and that is part of the problem. Why people in Congress want to take a look at Social Security now. Unfortunately, it's dangerous because the last thing you want to do is tell people you want to raise the retirement age, or you want to cut benefits, or you want to raise taxes, Social Security taxes, because all of those are non-starters in an election year. Nobody wants to do that in an election year because you're probably going to lose, and the graveyard of former elected officials is covered with people, tombstones from people who have died the political death by saying that they wanted to reform Social Security or Medicare, and that is part of the problem. Nobody wants to address it. Nobody wants to touch it, but yet somebody's going to have to do something about it. And Medicare has the same problems that Social Security does. People are living longer, costs are rising, you have a bigger group of people, which is wonderful that they're living longer, but when they're relying on Medicare and the costs of the system are getting greater and greater, you've got to make some decisions. And so the idea here is that, well, if we get rid of Medicare and have doctors and hospitals work for government, that's probably going to be a non-starter. We're a very privatized system here in America. That's the last thing that people want, is a socialized system. We can take them out and put them in health insurance. We've done some of that with Obamacare, reducing the costs over time. We can reduce some of the benefits or make them pay part of them. The Bush administration did that with Part D of Medicare prescription drugs. There was a big kerfuffle about that in terms of how dare you come out with such a horrible plan, and you're costing seniors all kinds of money. How dare you do this to us? Was really kind of the approach, and that didn't end well. That wasn't a pretty picture either. So we have more people in the system. But what that means is that you have more costs in that system, and it's great that people are living longer, but you're going to have to pay for that with more benefits if you're going to continue the benefits as they are. Otherwise, you're going to have to cut those benefits, increase Social Security taxes in order to pay for all of this, or you're going to have to raise the retirement age, or some combination of all of those, because this is a train going down the tracks, and somebody's going to have to do something sooner or later, or it's going to continue to cost more and more money, as we see. Now, where does the money go? A lot of this is hospitals and doctors' offices in terms of care. In terms of what we see here. So you see 33% going to hospital care, about 16% going to doctors' offices and whatnot. You see clinics and other things about 4%. Some home health care is a smaller chunk. Prescription drugs about 10%, a little less than that. And then other types of personal health care eating up about 15% of the budget. And that's just in the money that is spent on healthcare in those terms. Now, we're seeing some of these exchange subsidies haven't really increased, but with the projections, they have started to eat away at some of the Medicaid costs that we've seen over time. So they've eaten into some of Medicare, some of Medicaid in terms of these subsidies in trying to provide lower cost healthcare. And so it's a mixed bag. Some people say it's really working, others say it's not. It's just kind of, the jury's still out on that one. But the idea is, I think it is having an impact. How much of an impact is really the question that's at work here in terms of what we're seeing. Now, people were very opposed to this single national government program, as you can imagine, back in 2010 when it was first proposed and people were going through the motions. Now what we see is we see a lot of changes in terms of when you give people a benefit and they realize what the benefit is, and even if it's a little bit of a benefit in terms of what they're getting out of it, it's going to be very hard to take it away. And that's why we saw not a real appetite for repealing Obamacare back in the Trump administration in Congress, because people were like, what are you going to replace it with? Well, we're going to replace it with a better program. Well, what's the better program? Well, we don't know yet. Well, that's not an answer. To say you're going to repeal it and replace it, that wasn't good enough for people. And it ended up going down in flames because they didn't have an answer in terms of how you're going to replace it. And it's not an easy answer. It isn't. It isn't an easy answer in terms of trying to address it. But there's not a lot of appetite for changes, repealing and replacing it with significant changes until people know what those changes are. So that's why we continue to see this going on. Now, think of COVID without Affordable Care Act. Can you imagine without people being covered under these healthcare benefits, how different that may have been? We see a lot of obviously Democrats here because it is Obamacare, namesake being a Democratic president. But people who support the ACA, as you can imagine, are pretty much Democrats in this regard in terms of the Affordable Care Act, in terms of universal health care. We see a lot more support for that among liberal ideological voters here than we would see among conservative voters. And that's no surprise in terms of how the data breaks down. If we go back to, again, this data from Pew, looking at who's responsible, Democrats are saying, yes, government is responsible along these lines. And those leaning Republican would say, no, government is not responsible because, again, the conservative social ideology is that government shouldn't be involved in this. And even libertarians saying government shouldn't be involved in this types of things. This is really more of a liberal ideology than a conservative one. So where is the federal government involved in healthcare today? A lot of different programs. We talked about Medicare, the importance of medical care for senior citizens. The NIH we're familiar with because it's in our backyard. National Institutes of Health, looking at medical research and providing for new discoveries, research, and development in those spaces. We see the Surgeon General. Surgeon General important in terms of taking that scientific information and then using it in terms of trying to prevent disease and illness by coming out in support of different plans and programs in order to prevent illness and other types of programs that would keep people from a healthy lifestyle. So we see the Surgeon General, coming out in support of masks, in social distancing, 6 feet apart, definite contact tracing, all of that coming from the Surgeon General and the Centers for Disease Control, which we'll talk about in a second. The FDA is approving drugs that are being used in COVID. This COVID pandemic. They just approved the AstraZeneca drug because of its effectiveness, 79, 80% effective in terms of its effectiveness, and 100% effective for keeping people out of the hospital. So that's wonderful news. But the FDA is responsible for doing that. So very involved in new drugs, new research, new products that are out, and medical devices as well that are out on the market. Making sure that they're safe, and then testing them, and then getting them into the hands of consumers to make the consumers healthier and keep them healthy. Centers for Disease Control, as you can imagine, in this pandemic, very involved in the health and safety of our citizens in terms of issuing guidance about social distancing, issuing guidance on masks, on testing, on vaccinations, on really trying to drive those things in the state and local governments, but really kind of overseeing that on behalf of the president and the administration. Medicaid, we talked about a need-based program, very means-tested for medical care for poor and those below the poverty line. That would be Medicaid. And then we have Obamacare, the last one that we'll talk about here, addressing the idea of people who can buy into a health insurance exchange and hopefully get lower costs as a result of that. If they don't have health insurance, they can buy it. If they like their health care, they can keep it. But we know that's not been broadly based. That was the plan that was touted, but we have seen that in some places the competition is not as great as it once was without Obamacare, and that's an unfortunate side effect of the implementation of the Affordable Care Act that we see time and again. Now, what are we noticing? Well, President Obama said this as part of the Affordable Care Act in trying to get it passed in Congress and rolled out, was that we're spending more and more of our dollars on Social Security and Medicare and health costs across the country. And we're seeing this time and again. So our priorities have to change. We have to focus on this. It's becoming a larger and larger portion of our overall budget in terms of what we're paying into it. And you can see there, almost 65% was projected by 2010 to be 65% of the federal budget to be Social Security, Medicare, and other human resources programs. Now, we haven't gotten quite to that level, but it is significant and it is rising in terms of the overall approach. Remember, we see that the interest on our debt is growing, but Social Security and Medicare coverage is growing even faster than the interest we have to pay on our debt in that regard. So the point of this is that people have to do something in Congress and that's why they were looking at the Affordable Care Act to do something to help try and curb these costs, to try and provide more coverage for more people, but to try and curb costs in the process. And that's where we see this kind of take shape. Now, let's talk about the Affordable Care Act as we close out this this overview. It is called the Patient Protection and Affordable Health Care Act. It was more than 1,200 pages long. It was a significant win in Congress. Many people lost their seats in voting for this bill as a result of it. It required people to buy health insurance, and this has since been rescinded through the Trump administration, and the Republican Congress at the time removed that mandate, but it was seen as a tax. So you were paying a fine if you didn't buy health insurance. And the idea was that, and one of the most important aspects that people really like about Obamacare is the idea that you can't be denied for pre-existing conditions. There are so many people out there today who have changed jobs, and because of pre-existing conditions, they can't get health care coverage, or couldn't before Obamacare. Today, they can't be denied that coverage because of that plan. And that is one of the significant aspects that people love about affordable health care and Obamacare today. It also, for those that were younger and fresh out of college, it also provided an umbrella for those who were out of college and still living at home with their parents to have health care coverage under their parents' plan. So the coverage could be extended until you were age 26 under your parents' plan. Before, once you reached 18, you were basically out, and that was it. You were done. So you had to have your own coverage or find another way to handle that, or pay more to be on that plan. Under the Affordable Care Act, you could be covered up to age 26 on your parents' plan, and that significantly reduced healthcare costs and concerns for younger Americans that were concerned about not having healthcare coverage or not being able to afford to be able to buy it on an entry-level job. And the last piece that was covered here was a tax, essentially raising the Medicare tax by 0.9%, less than 1%, on those making over $200,000 a year. So that was significant because it provided a lot of monies that would then be used in order to fund these programs that we're looking at here. So in class, we talk about the debate, and we'll take a look at the debate on the Affordable Care Act, Obamacare. Is it good for America? We'll look at the pros and cons. We'll do some research, do some reading, and find out more as we take a closer look at that in that regard. Okay, a chance for you to pause the video here and answer some review questions if you'd like to. The Google Slides also includes supplemental data and some additional questions for you here in terms of what's happening, and you can look through those in the Google Slides on your own. I hope you found this overview video helpful, and we will see you in the next chapter on economic policy, one of my faves. So good luck on the upcoming assessment, and we'll see you in the next chapter.